Hello, this is Dr. Grande. Today I'll be covering 7 myths of depression. So when I use the word depression, I'm referring to major depressive disorder, as we see it in the Diagnostic and Statistical Manual. And these myths I've heard through my clinical experience, training, and also a number of them came from the internet. So let's get started with myth number 1. Myth number 1 is that depression is expected. Everyone gets it from time to time. It's not a real disorder. So I've combined a few phrases here to form this first myth. They're all really getting at the same idea, that depression is something that's normal, that everyone goes through it. And I think that the reason this myth was started and the reason it continues is because of the normal emotion or feeling of sadness. So when we think about mental health disorders, when we think about depression, somebody that doesn't have depression, really the closest thing they would feel to that would be sadness. However, depression is an extreme form of sadness that also has other characteristics. So it's really not accurate to say that if someone's sad, they understand depression as it really is. They understand major depressive disorder. But I think this is what happens. Individuals experience sadness, and therefore they believe they understand depression. And of course, sadness is expected. Everyone gets sadness from time to time, and sadness is not a mental health disorder. So really they're confusing the terms depression and sadness. We see the same thing with other behaviors that individuals without mental health disorders would normally exhibit that do have some connection to a mental health disorder. For example, if somebody regularly drinks, they might believe that they know what it's like to have alcohol use disorder. But alcohol use disorder, just like depression, is not really an extension of the normal behavior. Somebody that drinks a little too much wouldn't necessarily qualify for a diagnosis of alcohol use disorder. There's more to it than that. And of course with depression, there's more to it than just a lot of sadness. Myth number 2 is that depression is always triggered by stress. Now, major depressive episodes that occur in major depressive disorder can be triggered by stress, but they're not always triggered by stress. And this is particularly frustrating to people who have the disorder and to people that have loved ones or friends that have the disorder. Sometimes depressive feelings, the other symptoms we see in major depressive disorder, can come out of the blue, and there's no apparent cause. For some people, even after good things happen, a major depressive episode can occur. So they seem like they're not necessarily tied to stressors as concretely as you would believe if you believe this myth, that depression is always triggered by stress. Myth number 3 is that depression isn't dangerous or serious. Depression is quite serious. And even if you take away the risk of suicide and self-harm, depression still has a lot of consequences. It affects relationships, career, it has an effect on self-esteem and how productive somebody can be. It really affects a lot of areas of functioning. And it can, of course, be dangerous, as I mentioned, with suicidal risk and self-harm. So it is a myth that depression isn't dangerous. Depression can be dangerous, and it's quite serious. Myth number 4 is that you can't be depressed and anxious at the same time. So depression and anxiety are fairly common, and there's this belief that if you're depressed, then automatically you won't be anxious. Somehow these are mutually exclusive. And I think this just really comes from a lack of understanding of what depression is and what anxiety is. Not only can somebody be depressed and anxious at the same time, it's actually remarkably common. A lot of times when people have major depressive disorder, they also have comorbid anxiety disorders. Myth number 5 is that people with depression simply need to snap out of it. Now, this is a myth that I could apply to a lot of mental health disorders. A lot of mental health disorders have this myth where the person who has the disorder simply needs to snap out of it. Like somehow that's a solution to all these really painful feelings and experiences. You can't just snap out of a major depressive episode or from depressive feelings. It just has nothing to do with this disorder or really any of the mental health disorders we see in the DSM. So again, this myth is popular with depression and almost every other mental health disorder we see. Myth number 6 is that talking about depression will make the symptoms worse. And again, this is a myth you could apply to a number of mental health disorders. We know that mental health counseling, mental health talk therapy, tends to be quite effective for major depressive disorder. So talking about it in that context is usually helpful. Talking about it with friends or family can be helpful. There's really no evidence to support that'll make it worse. I think sometimes the reactions that people receive when they tell friends or family about depressive symptoms can seem to make things worse, particularly if it's a negative reaction. But that's a function of both people. That's a function of somebody talking about the feelings and somebody reacting to that. People talking about depression alone, that component doesn't make anything worse. It's the negative reaction that sometimes makes us think that talking about these feelings somehow is going to make the disorder worse or the manifestation worse. So really this myth speaks back to an important point, which is friends and family really will accomplish more for somebody with depression if they're supportive, if they don't contribute to the symptoms by having an unproductive reaction. Myth number 7 is that depression will go away by itself. Now this is a bit of a tricky myth because for some people, a depressive episode will end without treatment, eventually. There's a lot of suffering that will take place before it ends, but technically speaking, a number of major depressive episodes would be expected to end by themselves. But the myth is really talking about if you just wait, it's a better strategy. If you just wait, the depression will go away and you'll be fine without treatment. This is not true. In this sense, depression won't go away by itself. It will go away with terrible consequences, some of which, as I mentioned before, are dangerous and serious. We know that treatment tends to reduce the duration of major depressive episodes. So really the most effective way to get rid of depression is through mental health treatment, not through toughing it out or waiting it out. In some cases, this can actually make the depression much worse. Treatment is a productive way to go about addressing the serious symptoms we see with depression. I hope you found this video on 7 myths of depression to be interesting. Thanks for watching.